Welcome to Straight Talk. I'm your host, Eugene Chan. Our guest tonight is the Secretary for Civil Service, Mr. Patrick Nip. He has been serving Hong Kong people as a civil servant in various positions since 1986. More recently, he has been responsible for coordination of the COVID-19 vaccination program, which was formally launched on 26 February 2021. And now he's also tasked with the deployment of civil servants in the government's anti-epidemic work to fight against the pandemic, including the upcoming compulsory universal testing program to be held in March. Mr. Nip is going to tell us tonight what has to happen before Hong Kong gets back to normal life. Welcome, Patrick.
Yeah, welcome. Nice to be with you, Eugene.
Thank you, Patrick, for agreeing to be here with us via the online video, despite you are isolating. We know that you have to quarantine at home because Mrs. Nip has tested positive. And how's Mrs. Nip doing?
Well, thank you. So far, she's having mild symptoms, and I'm fine. And so I look forward to completing this home quarantine and to resume normal work.
Right. Any tips for us if one of our household members get infected? How shall we best to support them, since you have the first-hand experience now?
Well, first of all, stay calm. Mutual support is important. Personal hygiene very important, and get the relevant information, and also mobilize as much as family supports, friend supports as possible. Mm-hmm. So and so long as you are vaccinated. Mm-hmm. Most of them are having mild symptoms and should be generally fine.
Right. So Patrick, do send our regards, and we wish her a speedy recovery.
Thank you. Thank you very much, Eugene.
Right. Our viewers are very keen to hear from you directly because you have been on the front line the last 12 months, and especially you know what the government is planning for this pandemic. On Sunday, our latest vaccination rates were 88.5% for the first dose and 76.9% for second dose. So is 90% double dose still the magic figure we are trying to achieve, Secretary?
Well, it's important to have high vaccination rate to give the protection to us and to the whole society. The vaccination program has been in place for a year, and we will be reaching first dose 90% in a day or so. So we still need to work very hard to achieve, as you say, 90% second dose vaccination. And also for those having second dose for more than 3 months or 6 months, the third dose is also very important. So we still have a long way to go. But it's important that we realize the importance of getting vaccinated. And I'm glad to see the recent surge in demand. And we are stepping up our capacity to meet the demand as quickly and as effectively as possible.
Right, Patrick, this fifth wave has really hit Hong Kong very hard. We almost have 5 times the number of positive cases in all the 4 previous waves combined. At least close to 400 people have lost their lives. And, in Hong Kong, people are really suffering. And in general, I don't paint a negative picture, but I must relay some of the viewers' concern to you that everyone's life is being severely affected. Many are extremely worried, not only for themselves, but especially for the child and the elderly. And businesses are down, and even for those who are surviving are really having a hard time. And expatriates are leaving because they just can't meet their families, and those who want to go for leisure and business can't leave Hong Kong. So it's been like 2 years, and people are running out of resources and also patience. I mean, hopefully you understand. At Straight Talk, I'm going to tell you what's happening in the community. So just can you tell us honestly, if we reach a double dose 90% vaccination rate, is it good enough to lift us out of the current restrictions?
Well, I think you can look around the world. The pandemic is still with us. Omicron is highly transmissive, and the whole world is dealing with it. The basic is very important. We have to control the epidemic, and so that we could resume normal. And to control the epidemic, it's important that social distancing measures, early identification, early isolation, and early treatment is the basic strategy. And vaccination is most important, because unless the whole society is highly vaccinated, fully vaccinated, that can provide a sort of protection to control the current epidemic and also to prevent recurrence of another big wave coming.
Right. So, Secretary, as you know, that as a medical professional, we know that the antibody levels do drop off in time, and now we have seen that between the second and third dose, you have reduced the interval to say 3 months, and for the younger population from 5 to 17, between the first and second dose from 3 months to 2 months, you are actually trying to push the rate go higher. If I'm a bit more ambitious, since vaccination is so important, should we also aiming for the third dose having, 90% for third dose for everybody in Hong Kong? Would that be part of your plan?
Well, our plan is very clear, to get everyone vaccinated as early as possible. So it's important that people come forward to get vaccinated. The program has been in place for more than a year. And we see that particularly, for example, in the second half of last year, while we fortunately having basic zero cases for several months. But unfortunately, people did not come forward enough, despite all the promotion and efforts. But now we are stepping up the vaccination capacity. Our focus, the overall, the first dose vaccination rate, 90% in the field in a day or two. And then the second dose, we are now having close to 80%. Third dose, more than 1.6 million people having the third dose. Generally, it's not bad, but the priority group, particularly the elderly and the kids, are most vulnerable. And so that's the current focus of us to particularly expedite the vaccination of these two particular groups.
Right. So, Secretary, the University of Hong Kong's model for the outbreak now anticipates the fifth wave will peak between early to mid-March. And they predicted more than 180,000 infections and 2,800 patients needed to be admitted to hospitals daily, and with like 100 recorded deaths per day by the end of March, resulting about 3,200 deaths by mid-May if we keep going with the current restrictions. So, is this figure is something that you're expecting if we are not getting more vaccination, or should we even aim higher than 90%?
Well, I think you can see from the experience of other places with Omicron highly transmissive, the number of cases soared, and this is some sort of expected. But it's important for us to control and contain the epidemic, and one of the important priority is to reduce the number of serious cases and number of deaths. And that's our current focus now. And also for those who got infected, let them know about the what to do and what not to do, and so that they can really recover soon. So back to the basic is social distancing measures. Reduce the people's flow in the community and get vaccinated as early as possible. Now we have increased the number of vaccination centers. And now we have 23 centers. We increased 9 centers singly in February. And we are going to increase a few in the next 2 weeks.
Right. So, Secretary, you just earlier mentioned, you talk about, despite a lot of hard work, I look at your Facebook figures, for 6 months we only reached 50%, and recently, after 1 year, we have 80% for first dose, and only now we've got close to 90%. So it's interesting because it's free of charge, there are no waiting lists at the centers, we have plenty of supplies, and why are people not taking the vaccine? Some say about the myths about having have serious illnesses. So what would you do to encourage people to come up and continue getting over 90% or even getting a third dose? What would you do now?
Well, Eugene, you're right to say that we are fortunate. We have 2 types of vaccine to choose, free of charge, very good systems to administer vaccination. But from the experience of last year's, you will see that people are concerned about the side effects of the vaccine because it's new, it's for emergency use, understandable. But now in the world, over 10 billion doses have been administered already. So the safety, the efficacy is very clear. Secondly is that, there's some misinformation and a lot of, misleading information that people leading people to to think about that. Oh, it's very dangerous. It's not safe, and all that.
Right.
And another one is that the medical community at first was also, I must say, pretty conservative.
Yes.
And now is getting more forthcoming. So we are now taking the opportunities of the surge in demand. People are more willing to come forward to get vaccinated. We focus on outreach vaccination for the residential care homes because that's the high-risk place.
Yes.
And also for the kids, for the students' vaccination, and to let them get vaccinated through multiple channels, the way that the most convenient to them. No matter it's the community vaccination center or through schools outreach or our mobile vaccination units. So we are taking every possible means to facilitate schools, teachers, students, parents to get their kids vaccinated.
Right. Thank you, Patrick. Let's take a break and don't go away. Welcome back. Thank you, viewers, for staying with us. We have been talking to Mr. Patrick Nip on the importance of vaccination in this fight against the pandemic and the challenges he has faced with the vaccination program. So, Patrick, thank you for sharing with us the challenges you had with getting people to come to vaccination, and you talked about trying to increase the vaccination with the care homes as well as for the children with all the initiatives. And we know that our deaths, actually, if you look at the figures, for those, the death rate for the unvaccinated person is 18 times more than the vaccinated person. So it's very important. So I'm sure some of the viewers, apart from the hard work, they're going to say, why should you not do enough? Why should you do, for example, the vaccine pass, should it not be mandatory? Should it not be linked with the consumption vouchers? Has any of this been considered so that we can get an earlier rate of vaccination? Because in the past few shows, we have mentioned that some people will feel that the unvaccinated have held those having done the vaccination, hold them by ransom, that we are now suffering.
Well, not just from the world data, but based on the local data, it's very clear that fully vaccinated people would have much less complicated or severe illness than those not vaccinated. So during the fifth wave, you can see that more than 90% of the death rate, unfortunately, was those non-vaccinated. So apart from providing the right information, which we did, apart from encouraging people and introducing incentive, policy is also important. And that's why the government employee has taken the lead to implement vaccine pass in all government premises since mid-February. And then we have already launched the vaccine pass for the whole community. The sole purpose is to encourage people to get vaccinated, and it's important for policy. So we'll continue to introduce right policies to get people vaccinated as quickly as possible and get the protection. Third dose is important. So it's important that we also introduce a right policy to encourage and promote the third dose vaccination as quickly as possible.
So, Patrick, how will you respond to the comment that the government is underprepared for this fifth wave?
Well, I think if you look at the whole world, this wave is unprecedented. It's beyond the current capacity of many places. And with the Omicron, it also beyond the current capacity of the government and our healthcare system. Now, we have succeeded in containing and controlling four waves in the past year. So we have to recognize that. Now, for the fifth wave, it's really beyond the current capacity of our healthcare system. But with the support of the CPG, I'm sure that we would overcome it. And it's important that the whole community have this concerted efforts to deal with it. Now, yes, as far as the government is concerned, the testing regime, the isolation facilities, and also the treatment according to the priority, and focus on those severely ill and serious cases.
Yes.
And let the others to do it, maybe at isolation facilities or at home.
Right. Secretary, before we move on to the real other challenges that we're facing, I want to ask you a direct question. With with the schools now being closed, and they'll be returning back to school in 8 to 10 weeks' time. Professor Gabriel Leung has said that vaccination must be ramped up among the children before they go back to school. And even in the upcoming weeks, it may not be enough time to vaccinate all the children. And they are expecting another mini wave after the fifth wave, after it dies down in something April. Are you worried, and what will you do about that?
Yeah, this is an area of concern. We are racing against time. We know about the urgency. And you can see that the vaccination rate of students goes up recently. Mm-hmm. And since it's only recently introduced, at present 30% of the student population get the first dose. Our target is that by mid-April, 90% of the students get their first dose. And then just the second dose and all that. So we are trying our very best to facilitate schools, teachers, parents, students to get vaccinated. And then hopefully by the time that the school resume classes, most of the students will get vaccinated. And that's our target, and we have to work together to achieve that.
Yeah, thank you for keeping that in mind. So Secretary, I must relay also many viewers' concern because they know you're coming up. I'm going to list out their concern. Our confirmed cases now being increased exponentially, and we have about 60,000 confirmed cases now waiting at home as of last Thursday, waiting for the isolation facilities. And it's all right if you have a larger home, but for those who have subdivided flats, it's very hard for them to quarantine themselves. And our emergency department at the hospitals are packed. Patients are waiting a cold on the beds on the streets. This is something they never see in Hong Kong. And for waiting for ambulance, they could wait for 26 hours. There are stories of people in Penny Bay waiting for no results. Some of our staff cannot come back to work because the PCR test is not coming back enough in a short enough time. The prices of vegetables and meat has skyrocketed. I mean, this is, sorry, just to list all the people's concerns. I mean, I'm sure you're just as worried as I am. Are you confident with the Central People's Government help which is coming along? Is this going to do the job?
Yeah, I'm very confident about the support and help of Central People's Government. And also our concerted efforts of the community, not just the healthcare sectors. Now, we have to stay calm. And we know that for those vaccinated, the majority of them will be having mild symptoms. So we have to focus our resources on those non-vaccinated and those elderly and vulnerable groups. That's the first point. The second point is that we have to adjust our strategies and measures to catch up about the changes in the actual circumstances. So we have to make adjustments to our testing regime, our reporting mechanism, increase the number of the isolation facilities with the support of the central government, and also for the hospital sectors to do the triage and focus their resources to those serious cases and elderly.
So, Secretary, on the February 16th, President Xi Jinping said the fight against this pandemic is our first priority. Even our CE election was postponed. So far, we have seen mainland supporting us with medical and logistical expertise, food supplies, even prefabricated parts to build the hospitals. As you said earlier, it's really a race against time. But so far, from what we read in the news, that we are going to build like 60,000 places for those people that need to be quarantined. But if the rate of the infection is going exponentially, is it going to be built enough time?
Well, we know about the development of the Omicron and how the epidemics is likely to evolve. So we need to focus all our effort as a number one priority to control the epidemic as quickly as possible with the support of the central government. So that's what the government has been doing in our public health measures and in also enhancing our infrastructure to deal with isolation and quarantine, and also to support the medical systems to deal with the treatment side. And for the community, I think it's for the whole community to receive vaccination, observe the social distancing measures, and back to the very basic. I'm sure that we can overcome that. I'm confident about that.
Right, Secretary, I have to ask, because I'm reading on reports modeling by Hong Kong experts, they said the peak should the peak of this current wave should be between the first and second week of March, then gradually fade away in April. Hopefully the students won't get as another mini wave. So do we still need this compulsory university testing? Because by that time, all the cases should have been, has to be stayed at home. And why should we have to go through that test?
Well, yes, the modeling based on certain assumptions. It very much depends on how effective our current social distancing measures. And it's not enough, then we have to further reduce the people's flow, because this is the number one importance. Secondly, is that we control the epidemic, but by the compulsory universal testings, we find out all the positive cases as quickly as possible, as comprehensively as possible, so that we just not deal with the current wave, but also to prevent the recurrence of a new wave from starting. So this is important in terms of the whole strategy.
Right. So, Secretary, I mean, the government now, we are telling people that we're going to accept the red test, the quick test result is going to be confirm someone having been positive. And as you know, the rapid test is 80% accurate. One of our viewers, actually one of your former permanent secretary in the government, have passed a message to you saying, if that's the case, why don't we use that red test for the territory-wide? So it's much quicker we'll be able, although it's 80%, but at least we will find 80% of the infected individuals out, so we can actually get them quicker. Is that something that you have considered?
Well, when the epidemic at present is exponentially increasing, the RAT serves its purpose of finding the positive case as quickly as possible. The compulsory universal testings, by adopting a PCR test method, would find out those positive cases very clearly, and so that we can deal with them and treat with them, handle with them, very effectively. Right. So that would help not just controlling the epidemic, but proceed to the, COVID zero and prevent the recurrence of a new wave.
Right. Yeah. Patrick, lastly, a very quick question. Our current restriction is till April 20th, so hopefully everything will be controlled by then. Do we have a plan B if things doesn't get controlled by then?
Well, I think we have to focus our effort now to control the epidemic, not just the government measures, but every bit done by individuals contribute to the success of this anti-epidemic efforts.
Right. So, Patrick, thank you for being with us virtually tonight with your messages of vaccination. Hopefully, our viewers will ensure all their family and friends get fully vaccinated and even boosted. Thank you for watching.
Thank you.
Stay healthy and good night.